here.
Good morning, I'm a Clover over the low.
You're gonna hand this just the way you use it,
Okay,
alright? So you want it sideways,
sideways.
okay? Remember I showed you how to open it up sideways?
No,
It's okay. That's why we cover this. This is teaching, this is not barking because you're doing it wrong, okay? If you go to hand it to the surgeon, if you grab both, I'll do it for your camera.
Thank you.
If you grab both on the same side and pull,
okay,
it's right where you want it.
same side pool.
Yes. So try, don't have to fold it out, you just,
Under,
Okay.
under.
rather than that, so what I would do, I would pull it up and curve.
Curve.
You can just tuck your hands, as long as your fingers are all underneath and you can drop it on the hand, on the right hand, you're perfect, okay? So you just, if you literally do that, pull it up, tuck your fingers, do you see that move I did? I did this, and you roll it under, and then you drop it on the right hand.
Drop on right hand.
Drop on the right hand, because I want to dry just like you do, right?
Okay.
And I pick up with the right,
Okay,
okay?
so here you rolled under and
Mhm.
and right hand.
Close. All right, so we'll do this, and we won't take too long because of course we know it's time.
Okay,
Your drape step. Do I need my gloves first?
no. Okay. Will you come closer with that?
Yeah. Okay.
So then here,
Okay. Just reach in and grab it.
okay,
Smiley face towards whoever is wearing it.
okay,
If you were putting it on, the smiley face would face you. If you're putting it on me, the smiley face faces the surgeon.
okay,
Then you go in here, you find the corners, you grab them. You go in here, find the corners, pull it out, and then let it go. And that'll let the gown unfurl so that you can then present it to me. Since you've already got it by the corners, which is exactly where you want to be, as far away from as far out to the corners as you can be, because it presents the armholes better.
okay,
You're already there, so you literally drop it, spread it a little bit, and present it.
okay,
So it'll be like that.
okay.
I'll be over here.
Grab normal, smiley face towards you. I'm grabbing corners, and just let go.
See how that does? Now roll your hands under,
Under,
and then show this.
under,
Okay. I'll show you.
okay,
Now this is all learning, and you all pass this on to your classmates, right? So you've grabbed the corners. Don't let go. Just roll your hands.
okay,
Don't overthink it. You're literally here. You roll your hands under to protect your gloves, which are sterile, from the surgeon.
okay.
You see how that gives me all the armhole I need? Okay. So you've grabbed it. So grab it there.
Grab,
You've pulled it out. Okay. Try not to drag it on the floor. Now just roll your hands under, and then I'm gonna come down a little bit so you can see. I'm gonna come in like this. Don't come too far. Push in. Stop about there. Okay. Now my circulator's gonna come up behind me.
Hi,
Grab gloves.
grab gloves. Oh.
You need to.
Yeah, I'm okay.
Okay.
Okay. Open these over the basin.
both of them? Or,
And you would also
Do you
tie,
want the-
no,
oh.
you would also tie the bottom. What you're gonna do, I know it. Okay, so what you're gonna do, you're gonna come over here, you're gonna pull it out,
oh, okay,
okay? You're gonna get it ready over here, because if you do that over here and it slips, you've contaminated a glove.
one at a time?
One at a time, you can only present one at a time,
Oh, okay,
unless you've got forearms and you're hiding two I haven't seen yet, okay? This is a pro tip. See the words. The words go straight towards the doctor. They do not, you don't present like this or like this, because the thumb's backwards. If the words are facing the doctor, and you can literally, look down here, you can literally see it in the bag, in the glove. That means I can come straight in with my hand and it's lined up perfectly.
Okay.
Okay? So you literally take it out of the pack, pull it open, grab here, and grab here. Run your fingers off to the edge and bring your thumbs out. And you can see the words. If the words are pointed towards the surgeon and the thumb is straight out, you're good to go.
Okay.
And then you will present that about my waist level, and then you hold. You don't pull up into me. Don't ease off on me. You just want to hold steady pressure and let your surgeon do the work.
Okay.
For God's sakes, don't snap your surgeon. Okay? So from here, you go ahead and try that.
Sorry.
Open here. So words towards surgeon.
Okay, I'm going to show you one more thing. You're doing great, okay? Remember, T said if you had like 42 rubber bands and you try and pull it, you can't get a lot of clearance, right?
Uh-huh.
If you go all the way down in here and try and do this, you see what's happening to the glove? You want to get your fingers literally as close to the top as you can and still
Okay.
protected. And of course, you want the words to face the surgeon. You want to pull out.
Okay.
Okay? That's how you want to try and present it. Okay? I want you to have everything ready over here. Anytime you're fumbling, you run the risk of dropping. Okay? Now you can turn towards me. I'm going to come in like this, steady pressure, and as soon as I ease up, you let go. Perfect. I was pulled too tight on my sleeves, but that's fine. Words face me. There you go. All right. Now I'm going to help. Come in a little closer. I'm going to help. And then you let go. Perfect. And then I try to walk away and you go, "Can I spin you, Doc?"
Can I spin you, dog?
And I would say yes, but of course
What happened to the tag?
we've lost our tag.
Huh.
So if this happens, there's nothing you and I can do. The circulator would tie me up
Oh, okay.
because this is all now contaminated because it's outside of our box.
Okay.
Okay? So now what I'm going to do is I'm going to go over this way. Jenna's going to prep our patient by pulling up the blanket so we can get underneath it as our circulator. You're going to get the Mayo drape cover, which is our underbutt drape. Let's see. Just a little bit better. Okay. All right. Do you remember?
No. Right there.
Okay, so you're going to put your, here, let's start over here. This makes your life a whole lot easier. So, take it out. Take it out. Your hands here. What I'm going for, can you get in here, Sarah? What I'm going for is I want to grab like this,
Okay.
okay?
At the edge right there?
And then I'm going to hold it in my box. I'm over here. And then I'm going to push it out, and with my fingers, I'm going to drop everything that's in here so that it drops down. You want to try that?
Yeah.
Okay. So I don't want to have to refold this 64 times. So you're going to come in here, you're going to grab right here. You see how I just sort of hook her into the edge there?
Yeah.
And you bring it in, and you're not gonna do this. I can do this because I'm sterile. You're gonna hold it out like this, right? Making sure that it doesn't go past your gloves. Right? You two are taking notes, right?
Yeah.
You're taking notes, right?
Yeah, I'm paying attention.
You can learn a lot just by watching others.
Oh, I've
Okay, now spread your hands, and then just push it out. Push all that out.
there you go.
There you go. Now, You got 42 things to watch as you come in here. You gotta watch your gloves against this. You gotta watch your gloves against this. If the fingers were actually up here, you gotta watch your hands against this, right? So you're gonna come up, you're gonna tuck that under. I'm gonna help hold the dummy, keep it from going anywhere. Push, push, push. Watch your hands. Watch your hands. Far enough.
So it's like a wide
this?
spread.
Yeah.
You're touching down there, so you've now contaminated yourself, right? You don't have to come that deep, I don't believe, okay? You come in there, now gently just slide your hands out, leaving the drape behind. Good to go. Okay, and then you would say, Jenna, as my circulator, could you tuck that blue drape into the kick bucket for me?
Jenna, as my circulator, will you tuck the blue drape?
Okay. Y'all are so literal. Jenna, as your circulator, is just, I would say, Jenna, could you tuck that in for me?
Jenna, can you tuck that in for me?
And for God's sakes, your circulator has a name. Don't go, circulator. Did you do that? You don't know how many students do that. It's like, okay?
Okay.
Now, towel drapes.
All drapes.
Okay? So you're gonna hold him out, okay? What you're gonna wanna do, let's see how you've got them, done. That's the first step. Okay, that looks good. So what I would do is I would set them down, never on our sharps pad. Lengthwise.
Okay.
I would do this. How many did you make? 2. I would do this, and I would do this, and I would do this.
Okay.
And then I would do this, and bring them over.
Okay.
Because then all you have to do is present them to me.
Okay.
All right?
Thank you, Jean.
This. Turn over. Close. Over. And present.
Okay? Being mindful not to hit it. You didn't, but being mindful of where you're at. I'll take these from you one at a time. Oh, see, I put that one on backwards. That was my fault. Thank you. Okay, as soon as your hands are empty, you need to be moving.
Sorry, I'm going around you.
Perfect. Now what I would like you to do is, I almost did it again. I'd like you to angle a little more. You wanna have some clearance here,
Okay.
okay? That's perfect. Do I even wanna know what happened here?
No. No, you don't.
Okay? First things first, left handle. Oh, look, it's not where it belongs. So you walk around.
Oh, okay. Did I do this wrong? When would I put this on? Before you come in?
No, you would do that right now.
Oh,
Okay, don't touch the light.
don't touch the light.
So what you did was you did that.
Mm-hmm.
You don't want to do that. So the first step would be while you're setting up the room, you know this is where I want it, right? Because I need it glaring down here. So you put it up here.
Okay,
So now it's shining at the work area, right?
got it.
So then all you have to do is pick it up and it's in place. So go back to your station.
Back to station.
That's there.
Oh, he needs a light.
What a novel concept.
Okay.
I'm sorry, my OCD is going to
No,
kill
it's,
me
no,
now.
it's fine. And yeah.
What?
Yeah.
The stringer's stuck?
Sure.
Let's go with that.
Yeah. I'm supposed to take the stringer off, right? Right?
Well, once it's on the towel roll, yes. Okay, part of your issue is your towel roll. Okay? See how it's doing this?
Yeah.
Definitely part of your problem. Okay? For a stringer this short, I would make it this big, right? And then you just roll it up. I'm trying to keep a little tension as I roll it. See
Okay.
how I'm pulling in with my fingers a little bit?
Mm-hmm.
You get to where you're a little quicker about it. right? Once I've done that, I
Okay.
can't go anywhere, right? So then we can take that. Yeah, my OCD is not going to be able to stand that. One of the things you're going to notice as I play surgeon for y'all is I'm always habitually straightening up your Mayo stands, even though I'm not supposed to. Okay, Adsons, go over here with your specimen getters. Okay,
Quick question.
quick answer.
Do you want us cutting those, the tall flows?
Like
you are,
actually,
you are no, they're already cut 1/3, 2/3. You're just
We
telling
don't
me they're cut.
verbally tell you.
You're verbally telling me what's already been done.
Got it.
Okay.
Okay. Okay.
Does it stay here?
What
Sorry.
are you sorry for?
Because I fucked it up.
Welcome to healthcare. It's not the first time it happened, won't be the last. All right, I want my tenaculum.
Ugh.
Your first job is to stop and say, Doc, we need to do timeout first.
Doc, we need to do timeout first.
Oh, okay, fine, whatever.
We have Patty here, she's getting a D&C done, she weighs 99 kilograms, no known drug allergies. Our surge tech is Sandra, circulating is Jenna, and our surgeon is Dr. Dean.
And you look at me and say, Doctor, do you concur?
Dr. D, you concur.
I do. Tenaculum.
What's my tenaculum?
Single tooth tenaculum.
Single tooth tenaculum. Okay. No, that's not you.
There you go.
Single tooth tenaculum. And
The other way.
oh boy.
Have we talked about instrument passing at all?
Well, we did
Obviously
these
not
ones.
because of the way you're holding it. Okay. Catch this for videos, Sarah. If you are passing a clamp. Crap. Jenna, would you tie me in the back? Otherwise, I'm gonna be doing that all day and we're not gonna do that.
I think I remember seeing T how he said about passing the tenaculum.
So, anytime you're passing a clamped instrument,
Mm-hmm.
there's always what we call a box lock.
Okay.
Right? You're going to hold it at the box lock and you're going to place it in the surgeon's hands the way they want to use it.
Mm.
Okay?
Okay.
That's probably as advanced as we want to go for this case. You're going to do it like this. Eventually, we're going to get into when you smack it in and when you
Oh.
gently put it in and all of that. You will not ever use this one. I want to see small, medium, and large on the QS.
Okay.
Okay? Good, 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 good. So close. If you're gonna put these up, see how that's a 7
Oh, uh-huh.
and that's an 8?
Okay, yeah. Lowest number. Up.
This is the 7, this is the 8. The smaller the number, the smaller the diameter.
Okay.
All right. You want them all in one direction or another. T told you that during the original video, right?
Yeah.
So that looks good. However, this one, 9, 10, is backwards. Okay. So anytime you're passing a clamp, scissors, tenaculum, whatever, you're gonna hold it at the box lock. That gets you as far from the doctor's hands as possible.
Okay.
Because you don't want to be playing handsies when you pass, because now you're arguing over each other. You're just going to give it, they're going to feel the pressure, they're going to close, they will then adjust and do whatever they want. Okay?
Okay.
Don't worry about blades and all of that, we will get to that next quarter. So, you will pick this guy up like this, and then you will put it in my hand. It is a sharp, so there is no smack. You'll just say, and I always say sharp, sharp, and then I'll take it from there. If you're not going to leave it on your stringer, it goes on your sharps pad because it is a sharp.
Okay.
Okay. So if I think I have an extra second because of my time, I'll throw this right there while I'm setting up.
Oh, okay. Oh, that's nice.
Get your sponge sticks. Very good. The blue is showing. Very good. Okay, so we have done our timeout. I have concurred. And actually, the tenaculum is not first. I need the Alvard. Okay, again, that's where I want to grab it, right?
So can I grab here?
So, the other thing though, you never want to cross-body pass if you can help it. You always want to pass with this hand. For this
Oh boy,
case,
okay,
you're passing everything with your left. Are you like
right-handed.
right-handed? If it becomes a problem, your mission for the rest of this course is to brush your teeth with your left hand.
Okay,
And this is good advice for all y'all. Y'all need to get used to working with your non-dominant hand because there are going to be times when your right hand is tied down and you have to work with your left.
okay,
If you're it's got to be my right or I can't do anything, start getting ambidextrous now.
okay,
Very important. I would not put those up there. I would put those maybe on your hip or something.
okay,
So again, this is where I want to hold it, right?
mhm,
So you're going to hold it up here so that you can place it in my hand.
okay,
You're going to pass everything so that all I have to do is grab it and do what I want with it.
okay,
That's why when we teach you to pass these, you hold this up here and you put it in my hand because as soon as I can grab it, I can go right to work. Tip up. These are always tip up. These, you want to give me the smaller one first because, so why I put the smallest one away is so that I can pick it up and I can hand it to them.
okay,
I can pick it up.
The
Maybe
way-
I need to roll it a little because the tip is pointed up. I place it in their hand and they go right to work.
Right. So the way you were holding it just now, that's how you want to hold it, passing it to the surgeon.
That's what I would do. They would hold their hand out right here and I would just bring it in and they can go straight to work.
Okay.
The goal is so that they can go straight to work with it. They may have to adjust just because of the nature of the instrument. Like, you give me this, I can't go straight to work. I gotta get my fingers in it and go to work, right? But it's as close as we can get. I mean, you could hold it and they could say, just a second, okay, I've got it. They don't do that. Okay? Alvard first,
here, here,
okay?
here,
I want you to not double pass.
okay,
Don't pick it up with your right and hand it to your left. Literally, pick it up with your left and hand it to me. There you go. I don't know how they do this, but yes, it literally hangs there, the whole case.
Good thing the patient's under.
Thank God, because it's hanging off their vagina, the
I
whole
know.
case. That can only be painful. Now I need the tenaculum, please. Okay, and you want to come, you obviously don't want to come out from 50 yards away, but you want to come away from a little bit so you can then approach my hand so we don't do what
Okay.
you just did there.
Okay.
All right. And yes, you grab it right there. All right, you then ask me, would I like the sound or the Kevorkian first?
would you like the sound or the Kevorkian first?
I would like the sound, please.
Ooh, okay,
Okay. A little pressure, tilt down. Pressure, tilt down.
okay,
Okay. Tip up, very nice. Okay, that's about there. All right. Now I'll take the Kevorkian. Pressure, tilt down. Very good. Okay.
And
Can I use it
around.
like that?
No,
I want to use it like that, right? See this dent? This is where I want to hold it, right? So you're going to hold it like this. You're going to tilt it straight into me like that.
okay,
Okay? Try that again. The other thing you want to do, as soon as I throw one back, you're going to hand me this, and while I'm working, you're going to straighten that up. Okay? More, this is nitpicky now. See how you're doing this?
mhm,
If I have my hand here, I want you to come right into the groove of my hand.
okay,
Okay? Now I am curetting, and so that means I am creating a specimen. Don't you dare put over
I'm
my
sorry.
sterile field.
I'm sorry.
So you're going to grab the small telfa
small telfa,
and the Adsons.
but left with instrument, does it,
Okay, so in this case, you have to use both hands, so you're allowed to be comfortable. Also, you need to come in here with the telfa, so you would want to use your near hand for that.
okay,
Okay? So now, well, that's never happened before. All right, so what you're gonna wanna do is you're gonna wanna come in under here.
What, next to you, or do you want me to go around?
You're gonna come under here
Under,
and you're not gonna touch. You're gonna hold it right there and I'm gonna come out and you're gonna say, is this a specimen?
is this a specimen?
Oh, yes, yes it is. Could you get that out of there? Then, once I say that, then you can come in with the AdSense. Don't start grabbing until I say so. So you'll go in and just motion that you're getting stuff out of there. And then you're done, you take that back. You're gonna put it on the end of your table there. Keep the AdSense up here with the rest of it. And you asked if it was specimen, I said yes. The next question is, what do I wanna call it?
What do you want to call it?
Endocervical curettings.
Okay,
And how would you like it sent, doctor?
how would you like it sent?
Routine at the end of the case.
Okay,
So now I need a curette. Oh, now I need the dilators. Start with the smallest one, please.
oh, sorry. Here.
Okay. Again, my hand's pointed over here and you're hitting me like this. Literally hit the web, bring it down.
Okay.
Okay? So I'm gonna use this one, grab the next one and be ready because we're gonna work all the way up the line. Hello. I'm a Netley Echo. Do I make you nervous?
Yeah.
Trust me, y'all were making me nervous and I'm supposed to be the expert around here. Okay, look at where that's pointed. Okay. Do it here. So, do it here, like this, like that. Like this, like that. Okay? Try it again. That,
This.
like that. Perfect. Look at my hand and do it. There you go. Like that, that. Okay, now on that one, as you're handing it to me, tell me it's the last one.
It's the last one.
Thank you. Okay, so what I've done now is I've widened out the cervix
Okay.
so I can get into the uterus.
Okay.
I now have to go get some curettings from the uterus. So you'll ask me, what size would you like, doctor?
What size would you like, doctor?
Medium, please.
Here.
Thank you. This is specimen time. Same motions. Come on there. Don't put that down unless I need you to. You want this under here. Okay, the reason you want this under here is because as I come out, it's liable to fall out.
Okay.
And so this increases the chances that we actually don't lose the specimen. Okay? Same three questions. Can you remember what they were?
Is this a specimen?
Why, yes. Yes, it is.
What would you like this to be called?
Endometrial curettings.
Is this routine, or would you like this sent now?
How would you like it sent? Is the question.
How
And
would
I
you like it sent?
I would like it routine at the end of the case. She's bleeding. Okay, we have finished the procedure. What do we do at the end of the procedure? Somebody help her out. Closing count.
Okay.
So you turn around and say, Jenna, I'd like to count.
Then I'd like to count.
Okay, laps,
0,
Ratex,
1. Do I
Okay.
count? Do I point to you?
We always, okay, the order of counting. Start on the field and work your way out.
Okay.
So, go ahead.
1, 2.
You need to, so I want you to start one more time. I'm gonna, okay, go ahead. First off, pick those up and get them organized. You can keep those in your hands before you count. So now you're ready. So, here's how the count goes. 1 on the field,
Okay.
2 on the stick, 3, 2, 10. And you turn and count those to your table so that Jenna can watch you do it.
Okay. 1 on the field.
Point,
1 on the field. 1 on the table, or 2 on the table.
stick,
2 on the 1 on the field. 2 on the stick. 3, 4, 5, 6, 7, 8, 9, 10.
okay? I would like you to do me one favor. She has to see the blue and she has to see him fall, maybe even a little higher. 1, 2, 3, et cetera, et cetera, et cetera.
Okay.
Okay? All right, keep going, Jenna.
Okay, blanks,
0,
needles,
0,
typos,
0,
Goldie,
0,
scratch,
0,
pen and cap,
1, 2, 3.
count as correct.
You have to tell me that.
The count is correct.
Doctor, your count's
Doctor.
correct. Thank you, great, because I can't leave the room until you
Whoop.
tell me my count
Okay.
is correct. It happens every day.
Oh.
All right, do you know what your steps are next?
No.
Okay, so you're gonna move your back table back to the back of the room.
Back to the back of the room.
You're gonna come back up to the patient.
Come back up to the patient.
You're gonna grab those towels, you're gonna wipe them, and you're gonna wipe it all down into there.
Boom.
Yep.
Then, can I take this off?
Sure. Yes, yes, yes.
To chop it,
All right,
yeah.
into the trash.
Okay.
And you are done.
Oh, that was hard.
Yay!
Okay, have you reviewed any of the